Download our app available from the App Store and Play Store.
Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan. Let's look at today's daily bulletin. In a shocking response to an RTI query, the Central Drug Standard Control Organization, that is the CDSCO, and the Indian Council of Medical Research have admitted to multiple side effects due to COVID-19 vaccines that were administered to over 1 billion people in India. As per the RTI reply, Covishield vaccine shows AEFIs like injection site tenderness or pain, multiple red spots or bruises beyond the injected site, persistent vomiting without reasons, severe or persistent abdominal pains or headaches with or without vomiting, shortness of breath, chest pains were reported. Similarly, Covovax side effects includes injection site pain, tenderness, induration, fatigue, malaise, headaches, fever, soreness of muscles, joint pains, nausea or vomiting, chills, body ache or extreme pain in the limbs, asthenia, that is weakness or lack of energy, injection site pruritus, that is itching, rash, red skin, hives, enlarged lymph nodes, back pains, and rarely the dizziness or drowsiness. Ultraviolet rays are known to cause skin cancer at high exposures, and yet very little safety research has been done on the lamps used to dry nail polish in beauty salons. Now, a new study by researchers at the University of California, San Diego and the University of Pittsburgh in the US has uncovered concerning evidence of damage this overlooked source of radiation could be causing to our hands. LED nail polish dryers look like tanning beds for your hands. These use UV light to cure and dry some type of nail polish quickly and cleanly. The bulb on an LED nail polish dryer is less intense and has a different UV spectrum to a tanning bed, but the few rays it emits easily penetrate the skin with unknown results. The rural healthcare services in India are affected by an acute shortage of specialist doctors with around 80% shortfall of specialists at the community health centers, the Rural Health Statistics Report 2021-2022 has revealed. While it is mandatory for CHCs to be manned by 4 medical specialists, including a surgeon, physician, obstetrician, gynecologist, and a pediatrician, the report reveals that there is a shortfall of 83.2% of surgeons, 74.2% of obstetricians and gynecologists, 79.1% of physicians, and 81.6% of pediatricians. Overall, there is a shortfall of 79.5% specialists at the CHCs as compared to the requirement for existing CHCs. As per the report prepared by the Union Ministry of Health and Family Welfare, there are altogether 161,829 sub-centers, 31,053 primary health centers and 6,064 community health centers in India. Although these healthcare centers have increased with time, the Health Ministry could not fill up all the required posts of specialist doctors in these facilities despite the efforts for increasing the number of specialist doctors. Holding a Kolkata-based tertiary care hospital, Kothari Medical Center, deficient to provide highest standard of essential infrastructure, the National Consumer Disputes Redressal Commission directed the hospital to pay Rs 1.25 crore compensation to the family of a patient who died while undergoing a DNC laparoscopic dye test at the hospital. Although the commission exonerated the treating doctors, it held the hospital deficient for not providing the essential infrastructure. Summing up the lapses on the part of the hospital, the commission noted a few blank spaces were apparent in the consent form, age and weight of the patient were erroneously recorded, pre-anesthetic checkup was not done, the specimen of endometrium was not sent for histopathological examination, which was admitted by the hospital as it was lost and hence not sent for HPE. More importantly, capnograph, our all-proper multi-channel monitoring system of acceptable standard, were not available in the OT even though it was a tertiary care hospital. A recent study that was published in the Journal of Nutrition, Metabolism and Cardiovascular Diseases, it found that baseline triglyceride glucose, that is the TYG index, is very closely associated with the progression of depression. Also, from a metabolic perspective, if we take a look, TYG index monitoring, it actually requires pretty much more attention for mental health managements. Now, cerebral symptoms are very common among individuals with non-communicable conditions, while the longitudinal association between the triglyceride glucose index, the indicator of metabolic health, as well as the progression of depression still remains very unclear. So this study by Lang Jen and team aimed to check the association of birth TYG indicator and the depression progression in middle-aged and elder grown-ups. Now, group therapy relieves psychological distress. We all know, and it is quite essential for everyone to actually go through this. It also seems to improve the quality of life and results in fewer readmissions for heart problems. All this is in accordance to a study that was published in the European Heart Journal, a journal of the European Society of Cardiology. This study that I'm talking about, it included close to 147 working age cardiac patients with psychological distress, which was defined as a hospital anxiety and depression scale score of 8 or more for anxiety or depression. The average age was around 54 years and 67% were men. The participants were randomized to 5 sessions of group CBT plus usual cardiac rehabilitation or a cardiac rehabilitation group alone. A recent study has been published in the International Journal of Dentistry establishing the long-term effect of cryopreservation of the stem cells of the apical papillary cells extracted from the apical papilla of a tooth in its developing stage. Now, these cells are usually considered as an important part of the dental stem cells and are often useful in regenerative endodontic procedures. Now, what is this regenerative endodontic procedures? Now, these are procedures that usually include a triad of 3 important factors. Firstly, the stem cells, growth factors, and even scaffolds. So the apical papilla has been an incredible source for providing stem cells for regenerative endodontic procedures, as it is a developing tissue formed and it is usually present only at the time of tooth development. Moreover, the stem cells can be extracted from the same before the completion of the root formation. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.